Hello friends, welcome to my YouTube channel. Myself Rana Mane from KT Patil College of B Pharmacy is here with you to discuss on an important topic from B Pharm 3rd year 5th sem from Pharmacology 2nd. The name of the topic is drugs used in the therapy of shock. Definition of shock. It is abnormal physiological state resulting from widespread and serious reduction of tissue perfusion that if prolonged will lead to generalized impairment of cellular function. A life-threatening clinical syndrome of cardiovascular collapse is characterized by first, an acute reduction of effective circulating blood volume, that is hypotension. Second, an inadequate perfusion of cells and tissues, that is hypoperfusion. Now we will see types of shock. Shocks are divided into three types. First, hypovolemic shock. Second, cardiogenic shock. Third, distributive shock. Distributive shock is also divided in three types. First, septic shock. Second, neurogenic shock. Third, anaphylactic shock. Now we will see management of shock. How shock is managed. Now here are the agents that manages shock. First agent is isotrope. It is an agent that changes myocardial contractility. Second, vasopressor. It is an agent that increases blood pressure. Third, chronotrope. It is an agent that changes heart rate. Fourth, dromotrope. It is an agent that increases cardiac conduction velocity. Now we will see what is vasopressor. These are the agents that increases blood pressure. Examples of vasopressors. First, norepinephrine. It is most widely used vasopressor, potent agonist causing vasoconstriction in tissue beds. Third, resultant increase in SVR causes rise in blood pressure. Now we will see epinephrine. Epinephrine is nature's vasopressor, most commonly used during resuscitation, cardiac arrest, and anaphylaxis. Standard dose of epinephrine is 10 mg in 50 ml, that is 0.2 mg per ml. Dopamine. It is vasopressor agent. It is used in cardiogenic and septic shock. It is the receptor stimulation depends on dose given. Vasopressin. It is peptide hormone released from posterior pituitary. It causes increase in permeability of DCT and CT, increases water retention. V1 receptor present in the smooth muscle of a arteriolar wall and stimulation causes smooth muscle contraction and vasoconstriction. Now we will see types of shock in detail. First type of shock is hypovolemic shock. Improper tissue perfusion as a result of blood or other fluids from the body or inadequate fluid intake, any of which decrease intravascular volume. Causes of hypovolemic shock. First, hemorrhagic, that is acute blood loss. Second, burns. Third, excessive vomiting and diarrhea. Again, definition of hypovolemic shock. It is a serious and life-threatening medical condition which occurs when a person has lost more than 20% or one-fifth of the body's blood or fluids. This severe loss of body fluids leads to a substantial decrease in the ability of the heart to pump sufficient amount of blood to the entire body. Classification of hypovolemic shock. It is classified in two types: hemorrhagic shock, Non-hemorrhagic hypovolemic shock. In hemorrhagic shock, trauma, gastrointestinal bleeding is present. Non-hemorrhagic shock, external fluid loss, diarrhea, vomiting, polyuria, fluid redistribution, burns, anaphylaxis, etc. These are present. Signs and symptoms: anxiety, restlessness, altered mental state, hypotension, a rapid weak 3D plus, cool, calmy skin, rapid and shallow respirations, thirst and dry mouth, distracted look in eyes. Diagnosis of hypovolemic shock. In management of trauma patients, understanding the patterns of injury of the patient in shock will help direct the evaluation and management. Blood loss sufficient to cause a shock is generally of a large volume, that is, examples, external, intrathoracic, intra-abdominal, etc. Diagnostic and therapeutic tube thoracotomy may be indicated in unstable patients based on clinical findings and clinical suspension. Management of hypovolemic shock. Objectives: increase cardiac output, increase tissue perfusion. The plan of action must be based on: first, primary problem; second, adequate fluid replacement; third, improving myocardial contractility; fourth, correcting acid-base disturbances. Drugs used in treatment of hypovolemic shock: first, sedative; second, chronotropic agents; third, ionotropic agents. Second type of shock, distributive shock. As in hypovolemic shock, there is an insufficient intravascular volume of blood. This form of relative hypovolemia is the result of dilation of blood vessels which diminishes systemic vascular resistance. Examples of this form of shock or subtypes of this form of shocks are septic shock, anaphylactic shock, neurogenic shock. Septic shock, a type of distributive shock resulting from sepsis. What is sepsis? It is an abnormal wide inflammatory response to an infection that can result in death. Again, one definition of sepsis is: sepsis occurs when chemicals released into the bloodstream to fight an infection trigger inflammatory responses throughout the body, as shown in this picture. Clinical signs: hyperthermia, tachycardia, and wide pulse pressure. Treatment of septic shock: first, fluid replacement; second, supplemental oxygen; third, antibiotics. Antibiotics which survival correlates with how quickly the correct drug given cover gram-positive and gram-negative bacteria. Second subtype is anaphylactic shock. It develops from following exposure to allergens and cross-links IgE on mast cells, causing mediator release (release of histamine, isocyaninoids, LTS, PGS, etc.). Clinical presentation: urticaria and angioedema, bronchoplasm, hypertension, and CV collapse. Treatment of anaphylactic shock: if epinephrine is first line drug, standard dose injection 0.5 ml intramuscular. Repeat every 5 to 10 minutes if not improved. Third subtype is neurogenic shock. It develops secondary to a sudden loss of ANS functions following spinal cord injury, resulting in vasomotor tone and impaired cellular metabolism. Features: hypotension, bradycardia, poikilothermia. Management: it is managed by airway support, fluid replacement, dopamine, ephedrine, treatment of the underlying cause. The third main type of shock is cardiogenic shock. It is a state of inadequate cardiac output despite of adequate intravascular volume, resulting in hypoxia, that is cool motor skin, tachypnea, hypotension, altered mental status, narrowed pulse pressure. Causes of cardiogenic shock: acute myocardial infarction, myocarditis, aortic and mitral stenosis, narrowed pulse pressure. This is the diagram of cardiogenic shock. Now, treatment of cardiogenic shock. It is treated by the drugs like aspirin, beta blocker, morphine, heparin. If no pulmonary edema, IV fluid is used. If pulmonary edema, dopamine and dobutamine is used. Dopamine will increase heart rate and cardiac work is done. Dobutamine may drop blood pressure. Combination therapy may be more effective. Thrombolytics, that is streptokinase, RTPA. Thank you guys for watching my video.